and addiction psychiatry, highlighting their impact on clinical practice and patient outcomes. 1. Pharmacological innovations. A. Novel medications for substance use disorders. Buprenorphine, naloxone combinations. Recent formulations of buprenorphine, such as Sublocade, monthly injectable, enhance adherence and reduce the risk of diversion compared to daily sublingual tablets. Extended release naltrexone Vivitrol. Improved formulations provide sustained opioid and alcohol blockade, enhancing treatment retention and reducing relapse rates. Varenicline for alcohol use disorder. Originally approved for smoking cessation, varenicline has shown efficacy in reducing alcohol consumption in individuals with alcohol dependence. B. Medications for behavioral addictions. Naltrexone and SSRIs, utilized for managing compulsive behaviors in disorders such as gambling addiction, showing promise in reducing relapse rates. Modafinil, investigated for its potential to enhance cognitive function and reduce impulsivity in behavioral addictions like internet gaming disorder. C. Personalized pharmacotherapy. Pharmacogenomics, genetic testing to identify individual responses to medications like naltrexone and buprenorphine, enabling tailored treatment plans that maximize efficacy and minimize adverse effects. Biomarker-guided treatment, utilizing biomarkers, e.g., inflammatory markers, neurotransmitter levels, to predict treatment response and personalize therapeutic interventions. 2. Behavioral and psychosocial therapies. A. Cognitive behavioral therapy, CBT enhancements. Virtual reality, CBT. Immersive environments to simulate triggers and practice coping strategies, enhancing the effectiveness of traditional CBT. Acceptance and commitment therapy, ACT, emphasizes psychological flexibility and acceptance of cravings, improving long-term abstinence rates. B. Contingency management, CM. Digital CM platforms, use of mobile applications to deliver incentives for positive behaviors, e.g., drug-free tests, increasing engagement and adherence to treatment. C. Motivational interviewing, MI. Integration with digital tools, combining MI with digital platforms to enhance motivational strategies and support self-directed change in individuals with SUDS. 3. Technological and digital interventions. A. Telepsychiatry and teletherapy. Expanded access, telehealth platforms have increased accessibility to addiction treatment, particularly in underserved and rural areas, facilitating remote counseling and medication management. Effectiveness, studies indicate that telepsychiatry is as effective as in-person treatment for various SUDS, enhancing treatment reach and convenience. B. Mobile health, health applications. Recovery support apps, applications like SoberGrid and others provide peer support, mood tracking, relapse prevention strategies, and access to resources, fostering continuous engagement in recovery. Ecological momentary assessment, EMA, real-time data collection on cravings, mood, and triggers through smartphone prompts, allows for timely interventions and personalized feedback. C. Wearable devices and biofeedback. Real-time monitoring, wearables track physiological indicators, e.g., heart rate variability, sleep patterns to detect early signs of relapse and prompt immediate support. Biofeedback therapies, integrating biofeedback with behavioral therapies, enhances self-regulation and stress management in individuals recovering from addiction. 4. Neurobiological insights. A. Understanding addiction as a brain disorder. Neurocircuitry models, advances in mapping the brain's reward, stress, and executive control circuits have deepened understanding of the neurobiological basis of addiction, informing targeted interventions. Synaptic plasticity and neuroadaptations. Research into how chronic substance use alters synaptic connections and neural pathways provides insights into mechanisms of dependence and relapse. B. Neuroinflammation and immune system. Inflammatory pathways. Studies have linked neuroinflammation with addiction-related neuroplastic changes, suggesting potential targets for anti-inflammatory treatments to mitigate addiction severity. Microglial activation. Increased microglial activity in response to chronic substance use indicates a role for immune cells in addiction pathophysiology. 5. Personalized medicine and precision psychiatry. A. Genetic and biomarker-based personalization. Polygenic risk scores, PRS. Utilizing PRs to assess genetic vulnerability to SUDS, enabling early intervention and prevention strategies tailored to individual risk profiles. Tailored to individual risk profiles. Enhances self-regulation and stress management in individuals recovering from addiction. 4. Neurobiological insights. A. Understanding addiction as a brain disorder. Neurocircuitry models, advances in mapping the brain's reward, stress, and executive control circuits have deepened understanding of the neurobiological basis of addiction, informing targeted interventions. Synaptic plasticity and neuroadaptations. Research into how chronic substance use alters synaptic connections and neural pathways provides insights into mechanisms of dependence and relapse. B. Neuroinflammation and immune system. Inflammatory pathways. Studies have linked neuroinflammation with addiction-related neuroplastic changes, suggesting potential targets for anti-inflammatory treatments to mitigate addiction severity. Microglial activation. Increased microglial activity in response to chronic substance use indicates a role for immune cells in addiction pathophysiology. 5. Personalized medicine and precision psychiatry. A. Genetic and biomarker-based personalization. Polygenic risk scores PRS. Utilizing PRs to assess genetic vulnerability to SUDS, enabling early intervention and prevention strategies tailored to individual risk profiles. Biomarker-guided therapies. Employing biomarkers to predict treatment response and optimize medication choices, enhancing personalized treatment efficacy. B. Machine learning and artificial intelligence. Predictive modeling. AI algorithms analyze large datasets to identify patterns and predict relapse, facilitating proactive interventions and personalized care plans. Treatment optimization. Machine learning models recommend optimal treatment combinations based on individual patient data, improving outcomes and reducing trial and error prescribing. 6. Integrated care models. A. Collaborative care approaches. Multidisciplinary teams. Integration of psychiatrists, addiction specialists, primary care physicians, social workers, and behavioral therapists ensures comprehensive management of addiction, addressing both medical and psychosocial needs. Coordinated care plans. Development of individualized care plans that encompass medication management, counseling, and social support, enhancing overall treatment outcomes. B. Integration with primary care and mental health services. Embedding addiction services, incorporating addiction treatment within primary care settings facilitates early detection, reduces stigma, and streamlines access to comprehensive care. Screening and brief interventions. Implementing routine screening for SUDS in primary care allows for timely brief interventions and referrals to specialized addiction services. 7. Prevention and early intervention strategies. A. Public health initiatives. Education and awareness campaigns. Increasing public awareness about the risks of substance use and promoting healthy behaviors to prevent the onset of SUDS. Community-based programs. Implementing prevention programs in schools, workplaces, and communities to reduce substance initiation and promote resilience. B. Early identification and intervention. Screening tools. Utilization of validated screening tools in various settings, e.g., schools, workplaces, healthcare facilities, to identify individuals at risk for SUDS. Intervention programs. Offering evidence-based interventions such as motivational interviewing and brief CBT to individuals identified as at risk, preventing the progression to full-blown addiction. 8. Novel therapeutic approaches. A. Immunotherapy and vaccine development. Addiction vaccines. Research into vaccines that generate antibodies against specific substances, e.g., cocaine, nicotine to prevent their entry into the brain, reducing their addictive potential. Monoclonal antibodies. Development of monoclonal antibodies that bind to addictive substances, neutralizing their effects and aiding in relapse prevention. B. Neuromodulation techniques. Transcranial magnetic stimulation, TMS. Advances in TMS protocols target specific brain regions involved in craving and impulse control, showing promise in reducing substance use and preventing relapse. Deep brain stimulation, DBS. Investigated for treatment-resistant addiction, DBS aims to modulate neural circuits associated with reward and addiction behaviors. C. Psychedelic-assisted therapies. Psilocybin and MDMA. Controlled studies explore the use of psychedelics as adjuncts to psychotherapy, facilitating profound psychological experiences that can aid in overcoming addiction. Ketamine therapy. Low-dose ketamine infusions are being researched for their potential to disrupt addictive patterns and enhance the efficacy of behavioral therapies. 9. Behavioral economics and incentive-based treatments. A. Contingency management, CM enhancements. Digital CM platforms. Mobile-based CM programs deliver real-time incentives for positive behaviors, such as drug-free urine samples, increasing treatment engagement and adherence. Blockchain technology. Utilized to securely manage and distribute incentives, ensuring transparency and reducing the risk of fraud in CM programs. B. Nudge theory applications. Behavioral nudges, implementing subtle changes in the environment or treatment protocols to encourage healthier behaviors and reduce substance use without coercion. 10. Policy, advocacy, and social determinants of health. A. Policy developments, medication-assisted treatment MAT expansion. Legislative efforts to increase access to MAT, including buprenorphine and methadone, ensure broader availability of evidence-based treatments for opioid use disorder. Decriminalization and harm reduction. Policies aimed at decriminalizing certain substances and implementing harm reduction strategies, e.g., needle exchange programs. Supervised injection sites reduce the negative health and social impacts of addiction. B. Addressing social determinants of health. Integrated social services. combining addiction treatment with services addressing housing, employment, education, and legal support to tackle the root causes of substance use and promote long-term recovery. Reducing stigma, advocacy, and public education campaigns to reduce stigma associated with addiction, encouraging individuals to seek help without fear of judgment or discrimination. 11. Research and evidence-based practices. A. Longitudinal studies and real-world evidence. Tracking treatment outcomes. Long-term studies monitor the effectiveness and sustainability of various addiction treatments, informing best practices and policy decisions. Real-world data utilization, leveraging electronic health records and other real-world data sources to assess treatment efficacy and optimize care strategies. B. Clinical trials and translational research. Innovative treatment testing, ongoing clinical trials explore the efficacy of novel pharmacological and behavioral interventions, contributing to the advancement of evidence-based practices. Translational research, bridging the gap between laboratory findings and clinical applications to rapidly implement effective treatments for addiction. 12. Caregiver support and family interventions. A. Family-based therapies, behavioral family therapy, involving family members in the treatment process to improve communication, reduce enabling behaviors, and support the individual's recovery. Education and support programs, providing families with knowledge and resources to understand addiction, manage challenges, and foster a supportive home environment. B. Caregiver support groups, peer support initiatives, facilitated groups where caregivers can share experiences, receive emotional support, and learn coping strategies, reducing caregiver burnout and improving patient care. Conclusion. Addiction psychiatry is undergoing transformative changes driven by interdisciplinary research, technological innovations, and a deeper understanding of the complex interplay between biological, psychological, and social factors in substance use disorders. Advances in pharmacological treatments, including novel medications and personalized pharmacotherapy, are enhancing treatment efficacy and safety. Behavioral and psychosocial therapies are being augmented with digital tools and innovative approaches, increasing accessibility and adherence. Neurobiological insights are informing targeted interventions, while technological integrations like telepsychiatry and AI-driven predictive models are revolutionizing diagnosis and treatment personalization. Integrated care models and multidisciplinary approaches ensure comprehensive management of addiction, addressing both medical and psychosocial needs. Prevention and early intervention strategies, supported by public health initiatives and policy developments, aim to reduce the incidence and burden of addiction. Novel therapeutic approaches, including immunotherapy, neuromodulation, and psychedelic-assisted therapies, offer promising avenues for overcoming treatment-resistant addiction. Continued investment in research, education, and policy development is essential to sustain and further these advancements, ultimately improving outcomes for individuals struggling with addiction and reducing the societal impact of substance use disorders. 1. Pharmacological breakthroughs, introduction of novel medications and personalized pharmacotherapy enhance treatment efficacy and safety for various substance use disorders. 2. Digital and technological integration, telepsychiatry, mobile health applications, and AI-driven tools expand access to care and enable personalized treatment strategies. 3. Neurobiological understanding, advances in neurocircuitry and neuroinflammation research inform targeted therapeutic interventions, improving management of addiction. 4. Integrated and multidisciplinary care models, comprehensive care approaches involving multiple healthcare professionals ensure holistic management of addiction and associated comorbidities. 5.